Assalamu alaikum. This is Robert McCaw, CARE's National Director of Government Affairs, and this is the Daily Dose COVID Conversations with CARE. I'm really pleased to host today's conversation, which is States are reopening. What does it mean? We have a great guest with us today, but first I want to introduce our co-host, Saswan Salim. She's with CARE Georgia. Saswan, how are you doing?
Assalamu alaikum, Robert. Alhamdulillah, I'm doing great. I hope everything is going well for you and your family, as well as our viewers' families as well.
Yeah, Alhamdulillah. Ramadan Mubarak.
Ramadan Mubarak. It's definitely been a challenging and different experience for Ramadan, but Alhamdulillah, there's benefit where we look for it. So let's continue to make sure that we get that benefit, inshallah.
Most definitely. CARE, we set up a new website. It's carenewsroom.com. I do the Just the Facts section. It's like a daily news roundup, kind of like the Drudge Report, but Muslim and COVID focused. And we have two topics on there. We have Ramadan lockdown, where we talk about how Muslim communities are still thriving, connecting with each other, using platforms like Zoom, other online platforms to just connect, celebrate Ramadan, express themselves. And then we also have those who do good deeds. And we continue to see all this great, amazing charity work that Muslim communities are still able to pull off during the lockdown of the quarantine or as states slowly phase in reopening. Uh, we're really excited to have you on as a co-host today, but you're almost like a panelist because the state of Georgia is reopening, right?
Yep, a very, very frustrating turn of events. We are reopening. We have reopened since Friday, actually. So that has.
What is CARE Georgia doing? What are the mosques doing in comparison to the rest of the states?
So CARE Georgia has come up with a press release and gone on a different news broadcast to discuss the fact that different masajid will be remaining closed throughout Ramadan. I think what's really frustrating about this is that previously our governor had a mistake where he suggested right before he initiated the stay-at-home order that he had no idea that people who are asymptomatic can be carriers and infect other people. And so based off of that information, that knowledge of error, it's really frustrating to see that he is doing this once again and gambling with the lives of Georgians. So what some of the indicators to reopening the state is, number one, having testing available. Georgia has been increasing testing. It's still not at the level that it's supposed to be. And I know this personally because we have a family friend who went to the hospital suggesting that he had symptoms of COVID-19 and was turned away, said that he had pneumonia, and he was told to go home. It later turned out he had COVID-19 and he's actually now in the ICU. May Allah give him shifa. So that's really a problematic issue. And the second thing is that the number of cases declined for 14 consecutive days. That simply is not the case for Georgia. We have seen an increase of 3,177 cases since the date of the lifting of the stay-at-home order. So that's definitely not happening. And what we really are concerned about is not, I mean, of course, these numbers are problematic, but since the lift, we're probably going to see an exponential increase because people are now interacting with each other. And you have to understand that the nature of the stay-at-home order and what businesses are reopening. So we have barbershops reopening, we have restaurants reopening, we have bowling alleys reopening. And so if Governor Kemp is saying, maintain that social distance, well, with the barbershop, that simply is not true. You can't maintain social distancing when a barber is interacting physically with his client, his or her client. So that is definitely an issue. Bowling alley, same thing. You're putting your germs inside of the bowling ball, and that's you can't necessarily clean very well inside of those finger holes. So that's really problematic as well. And then contact tracing. So Georgia has announced that they are increasing tracing, but they haven't established that before the fact. They're now creating contact tracing forces. So I think that's also a really big issue.
Wow, that is a big data download. Thank you for that. Some quick questions for you. Now, I'm in DC, a little cynical about politics, been, an advocate for a couple of years in DC. A lot of people are saying that states are reopening just to save money on unemployment. And so if a state reopens, what happens to people that were furloughed or on unemployment for businesses that could now technically reopen?
Yeah, so we do have to take a look at the privilege that goes behind the stay-at-home orders, or the lifting of the stay-at-home orders. And yes, it is an issue of prioritizing our economics, our economy before the people. So yes, people will be not able to get unemployment benefits because they're going back to work. And you also have to understand the nature of the individuals who are being asked to go back to work. Those are people in the service industry who probably don't even have health insurance and
Or days off?
healthcare or days off, right? And so it's not only about them, it's about the people who they'll also be contacting. But when we turn this issue of being able to stay home as a privilege rather than a right, that's a really problematic thing.
Well, I think it's incredibly important that people follow guidelines like wearing face masks, that they socially distance if they're being forced to, actually go back to the work. That's why I'm really excited about today's guest. Would you like to introduce our guest?
Yes, of course, it would be my pleasure. So our guest is Dr. Hassan Chanawani, and he is the current president of the American Muslim Health Professionals, AMHP. His current position is at Blue Cross Blue Shield of Michigan, and he's a senior health/Medicare Advantage as the medical director for the clinical performance improvement. Dr. Chanawani has a career interest and extensive training and experience in systems-based practice, health policy, quality improvement, clinical informatics, and patient safety. He is board certified in internal medicine, pulmonary and critical care, and clinical informatics. Before starting medical school, Dr. Chanawani served as an assistant to the Chief of Staff of the Maryland State Governor, providing data-driven solutions to key policy priorities to the then governor of MD. He completed his medical school and an MPH in epidemiology and refugee health of Johns Hopkins University in Baltimore. After medical school, Dr. Chanawani completed a one-year civilian fellowship at the U.S. Army Center for Health Promotion and Preventive Medicine, part of the U.S. Army Medical Command, where he worked on disease outbreak management and on supply chain management and delivery of vaccines and chemical defense supplies to deployed U.S. Army soldiers in Kuwait and Kosovo. So I'm really excited to have him on because a person who lives in Georgia, this is a perfect individual to talk to about what it means to be reopening and if that's even a healthy endeavor or even. So I really want to welcome Dr. Hassan. Thank you so much for being with us.
Assalamu alaikum, guys, and Ramadan Mubarak. Thanks for having me today.
Ramadan Kareem.
Walaikum
Thank
salam wa
you.
rahmatullah.
So I have been hearing all about American Muslim health professionals for the last couple of years with our national work with the U.S. Council of Muslim Organizations. But since the founding of the National Muslim Task Force on COVID-19, you've been one of the key co-founders of this, working with other fiqh councils, providing guidance and direction to the Muslim community, houses of worship. Really, these guidelines are setting the tone for how mosques are operating throughout the country. So what led to the establishment of the task force? How did that come about, and how are you doing?
Alhamdulillah, it's been a long few weeks. Enjoying Ramadan as much as one can with my family. We're halfway through, by the way. Today, I think, is day 13. So we're already, in the bat of an eyelash, the month is going to come and go faster than you may even realize. To your question, the task force actually started out before Ramadan. And if you think about it, and we can talk about what it means for Ramadan and what's coming up in the next few weeks for Muslims in America and around the world. But when we started the task force in March, we basically had to grapple with the question of potentially canceling one of the most important fard or required parts of our deen, which is the prayer in congregation. I mean, the word in Arabic for Friday, Jum'ah, comes from the word Jama'ah, which means to get together, to congregate. And the Muslim prayer, as you know, is very different than your typical sitting in pews. We can't socially distance 6 feet. We have to stand. They literally tell us right before the prayer starts, shoulder to shoulder and foot to foot, right? That's what the imam always says. And plus we can't really isolate ourselves. We touch the floor with our faces. I mean, forget about touching your face. 1,000 people in the mosque are all going to touch their face at one time. Back to the task force, we had to grapple with the incredible question of, do we basically cancel Jum'ah across the country? And do we advise the 3 million or so Muslims in America to do this? And I will not lie to you, Robert and Sosen, there was a few of us that felt literally sick to our stomachs, because we understand how important this is and how big. I mean, just forget, just putting aside the question of if, whether it's a requirement or not, just the idea of not going to the mosque for weeks on end made all of us, some of us literally physically sick. But when we looked at the overall data and when we saw the hurricane of COVID that was coming, we literally a hurricane a day, thousands of people dying every day. We've already broken 200,000 people just in the United States alone. We looked and we really agreed across the spectrum, public health professionals, medical professionals, social science people, and scholars of religion and the leadership community. Over 25 organizations, CARE included, came together and agreed that we had to stop for the safety of Muslims. Remember, in Islam, one of the important hadiths is, you are responsible for your neighbors 40 to the north of you, and 40 to the south of you, and 40 to the east of you, and 40 to the west of you. And this is something that we can do where we could, God forbid, either protect or harm those people around us by our own actions. And so we had to inform everyone, Muslims, you have to stay away from the masjid. And we actually heard a adhan that I've never heard in my life, but instead of hayya ala salah, come to the prayer, they were saying, and I heard this in Kuwait and around the world, it's incredible, it's very haunting to hear, as-salatu fi buyutukum, pray in your homes. I had never heard that in my life, but around the world, billions of Muslims are being told, not just in America, stay at home, stay at home, stay at home, for the safeties of yourselves, your families, and your neighbors around you.
So what is your take on states already reopening without having all the test kits in place, or just crowds of people gathering without face masks? I went through my hometown that I'm living in, Vienna, Virginia, and I loved this town. The town center had several hundred people hanging around. Only half of them were wearing masks. I saw what Daytona Beach looked like in other places. People are starting to get back together now.
Yeah, I certainly understand the desire, feeling, staying at home myself. I feel myself incarcerated after weeks. It's very difficult. And I'm a lung doctor and I've been out of the house to take care of people and stuff. Also, as a lung doctor, I have seen hospitals, small hospitals, overwhelmed by the tsunami of death and destruction that this disease has brought on. I have had colleagues, friends of mine, doctors and nurses at 2 o'clock in the morning, something I never thought I would see in my life, on their knees crying just for it to all end. We've heard even about suicides in the physician and nursing community now, because this disease is overwhelming. I can't speak to the politics of why states are opening. I do know that there are some states that we are very concerned about. Indiana, we have a list that came out actually in the New York Times today. Indiana, Kansas, Nebraska have reopened businesses this week, even though the caseload is actually going up in those states. Likewise, Iowa, Minnesota, Tennessee, and Texas, according to the data, the case list is going up, and those states are partially reopening. Going back, Sosen, to what you said a few minutes ago, we agree that there needs to be a very principled approach, that certain things need to be in place. And we would argue that without those things in place, the task force cannot in good conscience recommend. And as of this moment, we are still recommending stay at home. We're having meetings almost on a daily basis to talk about the allowance of staying at home for extended periods of time, and who should stay at home and who would be allowed to avoid Jum'ah. A quick reminder, things like Taraweeh prayer at night, the Eid prayer, these aren't fards, these aren't requirements. It's heartbreaking to go. I've been saying to friends that this is like Christmas is being stolen from us. I get it, but those aren't requirements for us. If we can't advise that you should go to the masjid for Jum'ah, we would never advise that you go for something elective like a nawafil prayer or a sunnah prayer or anything. So we believe that there needs to be these principles in place. And if those principles aren't being met, we are not going to recommend that you start congregating together. And then even on top of that, we still would even recommend, because of the unique nature of which we pray, that you have to go through some questions that we are still working through to ask yourself, is it safe for the masjid to reopen? And what needs to be done so that the masjid can safely reopen? There's a variety of things that are being discussed, but that's still a work in progress.
Thank you so much, Dr. Hassan. And can you give us a little bit of an insight? So I previously talked about the different predictors or indicators that a state is ready to go into to reopen. Can you talk about some of the indicators that within the task force you have seen? What about like contact tracing, availability of testing? Can you talk about that really quickly?
So there's no consensus yet on what testing means. We don't know what to do with the test. We know what to do with the test medically if you're sick, that we're going to treat you for COVID, but we don't know what it means in terms of coming back to work. Do you need to isolate for 14 days? What does it mean if you have a virus test instead of a serology test? A virus test means that you have the infection right now. A serology test means that your body has seen the disease and has built up some reaction to it. It doesn't mean immunity. It just means that your body has seen it in history. Those tests are all new. They're very new. They haven't been established. To your question, we would want to see cases going down based on solid testing. We would want to know that that it's based on the test that we trust. We would want to see a persistent, robust reduction in cases going down, down, down. Not the plateau that you're seeing in America across the country right now. At best, we're seeing it maybe level off. We have not seen it go down across the country. And we would want to know what it would take, at what point in time would we say, we need to close things down again. Eventually, over time, maybe months and years, inshallah, there'll be enough immunity to the disease that we won't have to worry about this long term. But there are certain diseases that you'll never develop immunity to, and we'll see what's going to happen. Back to your question, we would want to see a robust drop in cases that is persistent over weeks, based on solid testing with data that we trust, before we would ever recommend that it is safe to reopen masajid. Islamically, what that means, we're still working that out with our ulama colleagues. There's a lot of concerns. No one wants to close the masjid for a period of time. And what's allowable here is a different question, but we're still working on it. And at this point in time, we're not recommending that anything reopen.
And I want to reiterate, Dr. Hassan, that you mentioned a plateau of cases, not, that you want to see a decline in cases and not a plateau.
That's right.
That is very important to consider.
That's absolutely right, Tosin. We would not, what we're seeing right now is a leveling off of cases. It could still go either way. Even if there is a drop in cases, that doesn't mean that we're out of the woods. It just means that what we're doing is working. It doesn't mean that if we stop what we're doing, that things are going to continue to be fine. All that means is that the measures that we have put in place at that moment that is going down is working. It doesn't tell us that it's safe to proceed forward. We need to be very cautious here. This disease is deadly. Today's New York Times alone has a really just tragic article about a Muslim funeral home that went from 3 or 4 cases a month of burials and janazas to over 15 a day.
Read that.
That's just, I mean, this is, I can only say to your listeners, to those of us that are watching this webinar, to my brothers and sisters in Islam, the people that we love, we want to go to the masjid too. Our families are dying. Our brothers and sisters are dying, and we can make that better and we can make that worse. We just have to be really careful here. It's why the task force is working with an abundance of caution. We tend to err on the side of keeping things closed. And again, we understand that a lot of people disagree with us and a lot of people may not think about the science and everything here. But again, just like when the Prophet ﷺ said, if there was an army behind on the other side of this mountain, would you believe me? Right? Sometimes we just have, I mean, that's what faith is. It's a step in the unseen. And it says in the Quran, ask the people of knowledge if you don't know. The people of knowledge at the WHO and the CDC and the public health experts, including our own Seema Yassin and Stanford, brilliant people across the country, they're all saying the same thing. Stay at home, stay at home, stay at home.
Thank you so much, Dr. Hassan. And I think we want to pivot to discussing unemployment and what it means for people who are now being required to go to work. What is your take on that? And what resources do you know of that are available to these individuals?
So this gets to a really challenging question. As someone myself, my wife is a surgeon. She works at the University Hospital here in Ann Arbor, Michigan. And she, of course, has to go to work, and there's a lot of challenges. There's a lot of questions as to what is considered essential and non-essential. There's a lot of things we're hearing now, for example, in the meat packing industry, hundreds of people are dying. And so the question is can we go without meat? Or, farmers, people fixing our roads, people fixing the sewer system and water. Obviously, the first question as to what is essential is absolutely important. There are not accepted guidelines on this. Again, we tend to err on the side of caution on that. And then absolutely, if you need to have essential, you need to do the protective measures. The CDC has an outstanding list. You can get to it from the EMANA website or from the AMHP website. They're members of the task force in terms of washing your hands, wearing protective equipment. You need to have the protective equipment. You deserve to have that protective equipment. The people that you serve need to follow certain rules and restrictions. They need to stay 6 feet apart from one another. I'm seeing now in supermarkets across the country that there are even these little spots on the ground where patrons can stay 6 feet apart from one another. And now I can tell you, even yesterday for iftar, my daughter and I, we were just hungering for a pizza. There's a great Muslim pizza joint here. They are staying open. Of course, they're only doing carry out and delivery. And when we told them that we were going to pick it up, and we've known these people for years, they're family friends, they said to us, Hassan, please, we need you to wear a mask. And they know what I do. They know I'm a lung doctor, and they know that I put people at risk as well. So they're like, please, when you and your family come to pick up the pizza, we can't let you in without wearing a mask. This is creating a new adab, a new etiquette that needs to be done to protect yourself and the people around you. We've also heard tragically here in the state of Michigan, a security guard asked someone at a dollar store to please wear a mask, and the person wasn't allowed in the store. They got very angry. They actually came back and shot the security guard, and he died. This was just this past week. So this is, and again, it's incredibly stressful. At the end of the day, Robert, you being in DC, I think the American people need help with 20, 30 million people unemployed. Just this is what government we feel is made for. Again, AMHP, I'm not speaking now as an AMHP member, but just as an individual, the American people deserve help. They need help. States need help. Towns need help. People should be able to stay at home and not starve to death. We should make it easy for them to stay home. We understand here in Michigan, for example, why people are protesting. This is incredibly difficult for them. The solution is not to reopen. The solution is to provide support for these people so that they can safely live at home and not starve to death and not be homeless and be able to live their lives and buy their medicine. I mean, from a health insurance standpoint, so much of our health insurance is employer-based. If you lose your job, you lose your health insurance, which means that you no longer can pay for diabetes medicines or heart blood pressure medicines. I mean, these things have a cascading domino effect that's tragic. So send back to your question, there need to be strict principles that keep both the people that patronize these places of business safe and the people who serve them at those places of business. They need to be kept safe too. The ability to work is a blessing, and the people who own these companies need to protect their employees and the people that they serve.
And just to add a note, CARE continues to monitor what's happening in Congress. Congress is reconvening. Even staff in Congress are worried about social distancing, their own safety. But it does look like, number one, the previous coronavirus aid packages passed. Unemployment is still there if states want to accept it. So that hasn't timed out yet. That's still there for a number of weeks. Congress is now debating extending that even further. I really do believe the House and Senate are going to get together and extend unemployment even further for those who are impacted. And hopefully there'll be other social safety net programs that they can adopt in these very stressful times. So that, Caribbean Advocacy Organization will continue to promote a larger safety net. And we are really voicing caution, not reopening at this time. There's a lot of Muslims that work in the meat industry. We've seen 58% of Tyson's meat employees have tested positive for corona, at least having antibodies. Hundreds of employees are out of work at the meatpacking plants, are afraid to go back. What has American Muslim health professionals heard from a very Muslim dominated industry for employees about the meatpacking plant situation, or what are you observing there?
So I can't speak to it specifically, and there's a lot of people that have more expertise than me on the specifics of the meatpacking industry. What I can tell you is what we're seeing in the news, that the work conditions on the best of days is really difficult. These people are forced to stay in really close conditions. There's a very high throughput. They have to slaughter a high number of animals in a short period of time. The very nature of the work, it's hot, sweaty work. So, most important, they have not been given the personal protective equipment, or PPE, that they need. That goes back to what Sosan was asking before about employees in general. Regardless of where you work, whether you work outside as a forest ranger and there isn't a person for 100 miles in any direction from you, or you work on the subway and you're surrounded by dozens of people, you need personal protective equipment. And that protective equipment depends on what you do and what you interact with, and the level of caution that you need to do. Those folks, they need to stay really close together, and they're not getting the equipment and they're not getting the protection. And we see that because the numbers are going up like crazy in that community of workers. It's tragic.
And that's why a lot of the plant employees are actually bucking the president's executive order, trying to force them to work right now.
Right. And just it's crazy. The other employees that I'm personally familiar with, obviously as a representative of them in AMHP at American Muslim Health Professionals, is of course we know the stereotype of Muslim doctors throughout, but there are Muslim nurses, Muslim anesthetists, Muslim CRNAs, every level of staff, respiratory therapists, a very large proportion of environmental services, the staff that clean the hospital. These are people, and the food service staff. There's a huge number of Muslims that work. You cannot step into a hospital in America and not meet at least one Muslim. Every single one and these are the people that are at highest risk. Think about the person that has to clean the room after a patient dies from COVID, right? The risk of exposure to that person is astronomical. They're not the people that we think of, but we're trying to advocate for them as well as health professionals. All health professionals, all employees, if you need to go to work to take care of people for whatever reason, you deserve the PPE for both their sake and yours.
Dr. Shanoani, you talked about how some individuals are more at risk than others. Can you quickly discuss different inequalities that you've seen, especially as a data-driven individual, different inequalities? I know that there are studies that have shown African Americans are more susceptible to contracting the disease and reaping impacts of that. So can you discuss about different inequalities that you have seen?
Absolutely, there's a lot that we're seeing in terms of various inequalities. The people that need to go to work, either they need to go to work for one of two reasons. One, because the job is essential, and a lot of essential jobs are by definition hands-on work, and so it's literally manual labor, and it's not work that you can physically do from home. I mean, think about it. You can't make a sandwich from home. So if you make sandwiches for a living, you've got to be physically in the place. The whole concept of remote telework is a privilege for high-end service industries that require a lot of equipment. Even us right now, you can see I've got a computer behind me. I'm on a different one right now. And my ability to remote work is a privilege that I enjoy at the high level that I am as a physician working for a large corporation. Local companies don't have those services and they can't do it. Think about if, just the act of cleaning, the physical act of being a nurse, these things require hands-on work. It's those groups of people that are suffering the most. That's an enormous inequity. Those jobs tend to track with in areas that are lower income. They tend to be lower income positions. And so people that are and also they're also hourly jobs. So you and Robert talked a little bit at the beginning of the session today about the ability to work and still get paid. If you're an hourly wage earner, if you're not a salaried person, you're not going to be able to get paid. If you take 8 hours off, you lose 8 hours of pay, as opposed to a salaried individual. So this is proportionally hurting people at that lower end who are hourly workers, who are hands-on, who are lower income, as opposed to other people that are able to socially distance and still work and still maintain a line of income.
Well, thank you for that response, Doctor. We have to wrap up the program. If you could put something on a billboard right now to let everyone know, the Muslim community, all of America, what's the one thing you need everyone to know right now?
The hurricane will be over eventually, inshallah. When, we don't know. It's a moment of uncertainty. Better days are coming, but for now, stay at home. And of course, the other thing I would put at the top of it is Ramadan Mubarak, and in a couple of weeks, inshallah, Eid Mubarak. Remember, these are days of wonder, and remember ad-duha. At the darkest moment, the light will come, inshallah. Allah loves us, God loves us, and better days will come, inshallah. We don't know when, but they will come. Bismillah.
That's a good billboard. Thank you.
Thanks
you
for
very
having me
much.
today, guys.
Thank you so much.
All right. Assalamu alaikum. All right. Well, with that, we're wrapping up. Saswan, that was an amazing amount of information for 30 minutes.
MashaAllah, it was. I agree.
So with that, we are going to do this every day. It's a daily program, the Daily Dose COVID Conversations with Care. Tomorrow's program is going to be at 3 p.m. Eastern Standard Time. It's going to be on local charity efforts in response to the COVID crisis, what the relief the Muslim community is providing. Saswan, again, thank you so much for co-hosting. This is really fun.
It's been a pleasure, Brother Robert. Thank you so much for having me.
But we're fun and we're making the best of it.
Yeah, alhamdulillah.
And for our viewers, also check out the website that we've launched where we connect what's happening with COVID with the Muslim community. It's called carenewsroom.com. Check it out. Check our program out tomorrow at 3 o'clock. Thanks, everybody. Assalamu alaikum.
Assalamu alaikum.